Eh, We haven't signed in. Where's Steven? He's usually only a couple minutes late, so I don't know. Second of seven.
I'm usually here online, so.
Yeah. Hey. Hey. Well. Oh God, glad you can make it.
Yes.
Alright. You said you'd be late, and I checked it to be here. I'm surprised. Um, but, I need a gift for this. Okay, what? Oh. And he's not online, I'm assuming.
You I recall.
Oh, that would be cool, thank you.
Or are you
Thank
contacting
you.
him? Oh, back there.
Thanks.
Patrick.
Where is this? I didn't.
2011.
You didn't have to come just now. Nice.
I like that bag, so, that was up something I would have like 500,000. I'm not a big bag person, but I got this from Madewell. I had a, this is my birthday month, so I had a coupon. So I got it for $5. Yeah, $35 off. Are you a Libra? I'm a Scorpio. Okay, so your birthday is coming. So. Interesting. Yeah, I don't know, but if you wanna read that.
Yeah. Thank you.
I gave her the one. Oh, yeah. Long benefits. There's a lot about it. Hi, Jacob, it says Steve. Hoping you're on your way to, the Florida office. We're meeting in the, the other. Hope to see you soon. Bye. I need my count, 6%.
Anona, yeah, we had this fruit thing, yeah, okay, Anona. It's funny.
I think the scientific name. I think I'm nice.
Can I get my, oh, yeah, sorry. Yeah, this is a special, exclusive, confidential, over. Okay. Yeah, the board sent out the flyer, and I sent it to the police direction, I didn't make the phone.
I think so.
I saw it. Yeah, I never saw the other flyer I sent in. to
They
the,
didn't do well?
What?
Do you know how they did?
Yeah, they did very well, fairly well. 145 people showed up. And I had the amount of tonnage as well.
That's a lot, that's considered to be a lot,
Well, they have done 200 in the past,
okay.
but you know, the weather wasn't the greatest either. But 145 is pretty respectable. She was happy with that.
Okay,
Thank you. Are we live?
Yes.
Oh my God.
I don't know. Yes, we are,
We're being,
I don't know, oh. They start recording, I don't know.
are we being recorded now?
Yes.
Oh, no. Oh, then we gotta look real.
Yeah, we are real. Steve,
I can take some notes by hand, but it's not gonna be anything like.
Okay, well, do what you can. I'm sure it'll be adequate. All right, so we're calling this meeting to order. Welcome everyone to the Community Board 12 Manhattan Health and Environment Committee meeting for October the 16th of 2025. This is not our usual meeting time. We've had to reschedule because of the Jewish holidays. So we'll be back on our regular schedule in November when we meet the first Thursday of every month. So this meeting has been called to order at 7:14 p.m. Sorry for the late start, but we do have a quorum, so we will proceed. So just for the record, let me mention to you the significance of this month. According to the Daily News, this is Domestic Violence Awareness Month, National Physical Therapy Month. It's SIDS Awareness Month, National Dental Hygiene Month, World Mental Health Day was October the 10th. And World Stroke Day is October 29th. That's probably a day you want to avoid. And we also have Eye Injury Prevention Month, Spina Bifida Awareness Month, Health Literacy Month, Global Hand Washing Day. Oh my God, that was yesterday. I hope everybody washed these
I am the
yesterday.
mayor of Mass Transit. We do not need a Q-tray. I'm in the subways every day. We have more than a capable system of transporting people with the infrastructure needed.
or,
That sounds like Curtis Lewa. Is,
But it's like coming from our.
yeah,
How?
is someone maybe, no, it sounds like we were picking up the mayoral debate for a while.
It was coming. Diana, can you mute?
Somebody's watching.
I am,
Now you're mute. Okay.
Oh,
yeah,
okay.
but I'm not listening to the debate.
Oh, it kept showing your green sign when it was talking.
Yeah, no, I'm sorry. There's maybe ambient noise here, but I'm not listening to it.
Okay.
Well, Curtis Lee was a special type of ambient noise, I guess. All right, let's move on with this meeting. So our first item is a presentation by a citywide organization which has a presence in our community called Start Care Treatment and Recovery Centers. And we're joined by Melissa Bernard, the Deputy Chief Programs and Strategy Officer, who is going to discuss with us a a new program that they are initiating in dealing, I guess, with opioid treatment. So, Melissa, I see you're in your office, or at least that's your background screen. So, you have a PowerPoint that you're going to show us?
Yes, I can share my screen.
Yeah, very good. And welcome to Community Board 12. We have
Thank
had
you.
people in the past from Start Care, and actually, I'm trying to remember. It went under another name some years ago. What was that name?
Start treatment and recovery,
No, it had another name before.
ARTC,
Oh,
addiction. Yes,
addiction. That's why Benny Prim's name sounds so
Yes.
familiar. That was
Yes.
his organization. Yeah.
This is still, yes. So
But,
I'll go over the history.
oh, okay, great.
Right. Let me just put it in presentation. Let's go. There we go. Alrighty. So just as an introduction, my name is Melissa Bernard. I am the Deputy Chief of Programs and Strategy here at Start Care. I've been with Start Care almost 2 years now. And Dr. Benny Prim, he is our founder. He founded Start Care back in 1969, and it was originally known as ARTC, which is the Addiction Research and Treatment Corporation. That's what you were referring to just now. He was actually internationally recognized for his behavioral health and HIV work. He was a physician, researcher, policy advocate. He also worked alongside 4 US presidents. He worked with Maxine Waters along the Congressional Minority AIDS Initiative in 1998. And he also believed in the concept of the one-stop service. So we have a new CEO. He's been with us for about 3.5 years now, John Aldoris. And he's really trying to push forward Dr. Prim's vision that he had 56 years ago, and that is to develop a one-stop shop for all participants within the community. So Start Care is known as one of the nation's oldest Black-founded community-based health organization. We currently provide comprehensive care, and that's what I'm going to be talking to you about today. Currently, we're providing services to individuals who are receiving opioid treatment, and we want to expand that to all individuals who have a substance use disorder. So currently we have 7 locations. So we have 3 locations in Manhattan, 3 in Brooklyn, and 1 in the Bronx. We just opened up our Bronx location in June. We provide behavioral and physical health support and biomedical research. We have a research and evaluation department. We provide integrated person-centered care through the lifespan approach. And our lanes of work, we have Article 28, 31, and 32. What does that mean? Anyone who's actually enrolled in our OTP, which is our opioid treatment program, they can receive specialty primary care, outpatient mental health, and addiction treatment. And just to go over who we serve. So as we mentioned, we provide a lifespan approach. So as of September 2024, we recently was awarded an extension in our Article 31, meaning that we can provide mental health services to anyone whose ages 5 and older. So anyone with a mental health and or substance use challenge can receive services from us. Our on-site clinic location for this service is at 124th Street in Harlem, Central Harlem. And you can also receive these services via telehealth as well. Now for our individuals who are 18...
I'm sorry, Melissa, as you go along, the site in Washington Heights is at Amsterdam Avenue and I think 161st Street, maybe 160th. Because as you go along, let us know which of the services are available at that location.
Yes, I will, yes. So for ages 18 years and older, you can receive our opioid treatment program, which we call the OTP. You also qualify for our REACH program, which will soon be known as our COP, the Comprehensive Outpatient Program. So if anyone has an opioid use disorder, they can receive the OTP program. If anyone has alcohol substance use disorder as a standalone or with a co-occurring mental health, they do qualify for the REACH program. Now, currently at our location, so we're at Amsterdam and 180th. And you can, and you can receive our service. You can receive the OTP services, and you can also receive our workforce training services. What I'm going to be discussing is the COP. So allowing individuals who have a substance use disorder as a standalone or with mental health to be allowed to receive services at our clinics. So currently, yes. So currently they can only if you have an opioid use disorder, you can receive services at the Washington Heights location. The next group of individuals we serve is all of New York City. So we recently launched our workforce training program. We received city council funding to provide workforce training to individuals within the community. That includes OSHA 40, security, healthcare, and culinary arts. We're currently piloting our OSHA 40 course in hopes to open up the other suite of services. At our East Harlem location, which we call Third Horizon, we have a culinary arts industrial kitchen. And we're looking to open up the training program there. And we're also looking to expand into security as our next phase as well. This service, the workforce training, is actively happening at our Washington Heights location on our 3rd floor. The last thing is our community-based engagement and harm reduction. This was also possible through a city council grant. So we're actively going into the community, roving the parks. We're actually at different NYCHA locations. We're also at public transportation hubs and really trying to engage individuals through the work of our peers. So individuals with lived experience. So that is something that we are trying to push forward and grow with the funding that we have. I'm going to go into the services that we have, and then I'll just quickly talk about the comprehensive outpatient program. So currently, these are the services that individuals would receive once they enroll in our opioid treatment program. So currently they'll receive medication for addiction treatment, outpatient mental health. Like I said, we have a research and evaluation team, meaning we pretty much try to look at our data that we have and really use that to fill the gaps and identify any barriers that we're seeing within the community, within the population that we're currently servicing. Primary specialty care. So integrated Hep C and also HIV. We are doing testing for that as well. We have psychiatry, the community-based outreach and engagement, harm reduction trainings. We go into the community. We do provide harm reduction trainings to anyone who's requesting trainings. We have done a lot of trainings in North Brooklyn. We received a grant from St. Nick's. And we're currently doing work with them. Harm reduction, education, and supply distributions. We also offer during like health fairs and events, we provide Narcan distribution. And then also our vocational fulfillment, which is work readiness. We provide computer literacy trainings, resume writing, and interview prep. Now, today, I really wanted to talk to you about our comprehensive outpatient program. So we're applying with the state organization called OASIS. They are the governing body of all substance use programs. So currently, like I mentioned before, we are only open to enrolling individuals who have opioid use disorders. We would like to begin to enroll individuals who have any type of substance use disorder, alcohol disorder, marijuana. We want to provide that space for them. So these are all the services that they will be able to receive within the COP. As you can see, it is pretty much the same services that you can receive if you have an opioid use disorder. So really, it's just for us to transition over and merge the two programs. Um, One thing that you'll see here that's different from the OTP that we currently do is methadone and buprenorphine. So that is the only thing that will be different within the COP. Is that we are blending our OTP program, so they'll be able to continue to receive methadone, buprenorphine, and all the other services are the same. So they'll have access to everything. The criteria is 18 years and older, OUD diagnosis, and an interest in medication for opioid use disorder with or without mental health diagnoses. And the location that we currently have these in. So we have an active program in Fort Greene, but all of our other sites are slated to become COPs except our Bushwick location. And my last slide is really just the anticipated community impact. So, our goal is really to help with the, uptake of mental health services that we can provide within the community, reducing untreated mental health needs, increasing the community mental health response preparedness. And this is also working with our outreach team, reducing fatal and non-fatal overdoses, decreasing the mental health crisis as a whole, hospitalization. The goal is really to reduce the amount of individuals who have to be hospitalized. And that's through mental health and or drug or alcohol use. I know I said a lot, so I am glad to go back through anything. I just wanted, for the sake of time, to just get through as much as I can. On the information.
If I can, so at the moment, this program does not yet exist in Washington Heights. Is that correct? You're waiting for approval from Oasis?
Yeah, so the opioid treatment program that exists.
Right.
What doesn't exist is that we're unable to enroll individuals who only have who have other substance use disorders.
Right. And so in Washington Heights at 180th and Amsterdam, I had you mixed up with another program down at 161st Street.
Okay.
So yeah, now I remember you came to us, well, I guess other people, your predecessors came to us years ago when they were looking for a new location in Washington Heights. And so at 180th and Amsterdam, how many people do you now serve with opioid use disorder, and how many more people would you serve were you to get the approval for the new program?
So I can get that exact. I'm gonna give you the exact number. So as far as the amount of people that we're going to service, we are anticipating potentially, we always say like a 7% increase in individuals that we can provide service to. One thing about our program is that once individuals are enrolled, usually those are the same people that we are constantly seeing. So right now at our Amsterdam location, we have 389 participants.
I'm sorry, 389?
389.
Right.
And out of those individuals, we have 56% are Hispanic, 19% are Black, 75% are male. And we're seeing that that is the demographic that's, highly affected by the opioid crisis. So that's one of the other reasons why we want to be able to open our doors to more individuals who may have additional needs as well.
And those 389 individuals are coming from our district or, okay, just from our
Yeah,
district?
so it is a mix. And that's why we recently opened up our Bronx location, because we realized that there are some individuals who are within our clinic who are coming from the Bronx. So recently, our counselors have been meeting with individuals who are not from the district to let them know the opportunity to working with the clinic in the Bronx. We've had about 3 people. I have to double check, but I'm pretty sure we have 3 individuals as of June who've transferred over to the Bronx location.
Okay. Still, the majority of them are from our district.
Yeah,
Yes, majority is from the district, yes.
and,
We
and,
do
and
have a few
again,
people who are sprinkled.
yeah, and to be clear, the district that we cover in Washington Heights and Inwood runs from 155th Street on the southern end northward to 220th Street.
Okay, yes.
All right.
How do you get funding?
So we bill Medicaid. So that's our main source of funding. But since our new CEO has started working with the agency, we have been diversifying our forms of revenue. So as I mentioned earlier, we are starting to receive grant funding from the city council. So that's part of the funding. Also, Oasis, they tend to push out some RFPs. So usually it might be around like peer work or vocational work, computer advancement. So we apply for those grants and utilize those funds.
So you're not getting any grants from or used to get any grants from the federal government?
No. Any federal funding we receive is through our research program. And usually we work with educational institutions. So right now we're working with NYU. So they're the ones who would receive the federal grants, and then we would receive it as like a third party.
So do you see any cuts from that pool of money?
Not yet,
Okay.
no. But it's definitely something on our radar.
Any other questions?
Steve, can I make a suggestion also?
I recognize Julio Batista,
Yeah.
who is the Community Affairs Liaison for New York Presbyterian Hospital.
Yeah, all I was gonna just suggest is there's an organization that's led by Dr. Charles Corliss from the Inwood Community Services. And for the last several years, he has put together a group of organizations that deal with substance abuse, mental health in Washington Heights and Inwood, where they will come together bi-monthly and serve as advocates for those services, but also to share information and establish collaboration. So, that'll be a great organization, a meeting for perhaps Start Care to be a part of, because it does lend to collaboration and greater awareness of the work that your guys are doing.
That's
So what's the name of the
excellent.
organization again? Sorry?
Well, it's referred to as the
North Manhattan,
yeah. Go ahead. Yeah.
it's part of what they call the North Manhattan Agenda, and it's a mental health subcommittee.
They may call themselves the Behavioral Health Committee.
Yeah.
It's one or the other. Melissa, I will send you the contact information. This is an excellent suggestion, and it's a way in which your organization would really be more connected to all the other groups in Washington Heights that are providing somewhat comparable services. Although really, I don't think there are that many that are doing what you're doing. But it would be good for the other groups to know that you're there and you're providing this type of service. The group that I had you confused with at Amsterdam and 161st Street is called the Alliance for Positive Change.
Oh,
And
yeah.
and in my mind, they also do similar work.
Yes,
Um,
they do.
and so you know, I was thinking that's where you were coming from. So but it's good to know, in fact, at one point nobody was doing this kind of work in Washington Heights and Inwood, and it's good to see that we now have at least two or more organizations that are doing who are trying to address this very important problem.
And I do want to add, you know, we just started the workforce training program, like I mentioned. We just
Yeah.
started that in May. And interestingly enough, we're having a challenge getting people in the door. And this is a free service. And we know OSHA training can cost up to like $325 per person. So, you know, I think it's really important for us to, you know, speak at, you know, these community committee meetings, just to let them know that these services are available. We do go into the community and share out flyers, but you know, within the Black and Brown community, I know it's very hard for people to trust, right? Especially in the political climate right now. So it'll definitely be great for us to share more with advocacy groups who can speak to the people, you know, people who will trust them to let them know what we have.
Right, and you should also send those flyers to our community board office, and then we should also help to spread the word.
Yes, definitely.
All right, so you need a letter from us that confirms that you made this presentation. That would
Yep,
be sufficient.
That's
That's all
it.
you need? Okay.
Yes.
All right, well, and is there a deadline for that?
No, it's as soon as you can. I already met with Oasis. We had our regional meeting. So this is the only thing we're waiting for. But we're not in a rush. So
All right, well, we certainly should be able to get you something you know, by the end of the month, I would, if not sooner.
okay, thank you. I appreciate that.
Okay, well, thank you for coming, and hopefully you'll keep us posted as things progress.
We definitely
So you
will.
know, this meeting is recorded, so you can find this recording on YouTube or
Oh,
on Facebook.
fantastic.
Yeah.
Okay, great. That's good to know.
Yeah.
Thank you so much. I appreciate your time.
All right, thank you.
Okay, bye.
Okay, next on the agenda, Pauline Ferranti, Borough Liaison with the Department of Health and Mental Hygiene. Pauline, are you with us?
Hi,
Maybe not.
everyone. Yes, I'm with you. Hi, Steve. I was waiting for your COVID update.
Well, you know something? I think your department has ruined my updates. Now I went to the website and it's like completely changed. There's no longer, it doesn't seem to have the zip code specific information that it had in the past. And it only has very general information and charts that are based on either citywide or borough-wide information. Have you taken a look at that, the COVID data?
I'm just looking at it now. We probably did do here, track data by zip code. Yeah, I guess they did change the website.
Yeah, so
I'm gonna tool around with it, and then
okay.
I will let you know sort of
Yeah,
how
please. Yeah,
things change.
yeah, you're ruining my my big effort here to try to keep up to date on how our particular community has been affected by COVID. So, but the information that I did glean from the website is that hospitalizations resulting from emergency department visits citywide increased 6% last in the week ending last Saturday, October the 11th. And then there's a note on the website that says that this may not represent everyone with COVID, but apparently just people who presented themselves at emergency departments.
Right.
And
Tested.
and,
Yep.
and then there's a separate statistic which I don't know how it jives with this other one on lab reported cases, because those decreased by 25% as of the end of last week. And then I guess on the positive side, the deaths resulting from COVID decreased by 100% since the prior week. So that's obviously great news. And as of the last meeting that we had on September the 4th, the figures for our community, for our 4 zip codes, showed that in the course of this pandemic, over 1,000 people in our community had died from COVID, 1,045 to be exact. And there were,
Just in how long? Sorry, 1,000 people in
uh,
what period?
since the beginning of the pandemic, 1,045, and there had been 76,279 cases just within our district, our 4 zip codes. So if you can find where this information may now be stored, I would appreciate that. And then I just want to mention the acting health commissioner today put out a statement, a pretty good statement about the need for people to still get COVID vaccines, and specifies here that in New York City and New York State, all adults are recommended to get the updated COVID-19 vaccine, particularly if you are 65 years of age or older, are pregnant or postpartum, have underlying conditions that put you at a high risk for severe COVID-19, such as chronic conditions or immunocompromised status, are at higher risk of exposure or exposing others. For example, if you are a healthcare worker, you live or work in a congregate care setting, or you live in a multi-generational household. So I'm glad to see that the health department is still putting out the message that people should get vaccinated. And actually, she goes on to mention that that it's also important to get your annual flu vaccine, and if eligible, an RSV vaccine to ensure you have the best protection this respiratory virus season. So now I'm turning it over to you, Pauline. I'm sure you have much more to say.
Yeah, no, thanks, Steve. I appreciate that. I didn't realize that they had updated the website, so I will look around and make sure that the zip code data is on our website, and also that, to share where you can find it.
Right.
But I would remind everyone to kindly visit our press release page, because there's lots of great information. This one from yesterday, I'm sure OC would be very interested in knowing that we are vaccinating raccoons against rabies, and the parts of Manhattan are obviously Upper Manhattan in the park. So we just want to make sure people in Inwood Park, we want to make sure people know that this is happening. If you have pets, to try and avoid having them walk off leash, because dogs might eat this. It looks like a little ketchup packet. It's like brown. I don't know if you guys ever seen one before. It's not harmful. So like if your dog eats it, it won't hurt them, but it's just not ideal for them to eat it, because it's not meant for them. It's meant for the raccoons to vaccinate them against potential rabies. And I wanted to just pull up the map, because I know that that's something we are all interested in. And thankfully, Manhattan is still looking pretty good. This is as of the 15th. So it's new as of yesterday. So this is all very helpful. I know you asked about polio, Steve, but we don't have any updated information about polio. It doesn't seem to have any serious implications in the city currently. But I know that we did have 2 cases of measles in Manhattan, but they were in Lower Manhattan, and the 2 cases, the individuals were known to each other. It wasn't a travel case. Their vaccination status is unclear, but they were adults. So, just wanted to share that information. And as of the 10th, there have been 16 measles cases in the city. So we really encourage people, especially parents, to make sure that you get your kids back on their MMR vaccination schedule. And you can also look at information, cases by year. We are 2 over from last year. And as you can see in 2019, there was like that huge situation in Brooklyn. So hopefully we don't see that again, but we really are encouraging everyone to please, get vaccinated, know your vaccination status. And then again, I'm going back to our press release page because there is a lot of really interesting information. There's this new sugar warning that went into effect for large chain restaurants, for them to post about added sugars because, in an effort for people to make informed decisions about what they're eating, and to prevent, chronic illness, including diabetes. We really want people to be aware of the added sugar content. And then we were talking about mental health earlier. So I just wanted to highlight this, that there are a lot of information about mental health happening. And, there are a lot of resources available. So we encourage people to attend these community mental health, wellness, and resilient workshops. So if you just click around these sites, you'll be able to see if there's a workshop near you. I think there's one in like the CB9 area, but, of course, we want people to have access to things. So, hopefully we can find more partners who will be able to partner with us to be able to provide this information to the community. So anyway, if you could share all of these things with your community, have people sign up for these workshops, that would be really helpful. And of course, I am happy to take any questions, and I'll go back to our main page of the website.
Well, I tell you, in terms of the mental health workshops, as Julio mentioned just a while ago, we have a very active consortium of groups working on mental health issues. I'm sure they would, as well as our community board, would support and help with this, with organizing and promoting any kind of mental health workshop in our community. So I would hope that we could. You could take that back, and hopefully we can get one at least one in Washington Heights and Inwood.
Definitely. Yeah, I will take that back to our team just to see who, their partners are and whether or not the consortium in Upper Manhattan is some a group that we're connected with. And if not, I will definitely reach out and ask for your hand in, making those connections. That would be really helpful.
No, I would be very happy to make that connection. Especially if we can, solidify the connection with the health department and then have have one of these mental health workshops. Any OC has a question?
Yes, any update about the rooster on
Oh, yes. I completely forgot. I don't know how, but the mayor's office is now involved. And I believe the NYPD was dispatched to go either today or sometime earlier this week. And I was told that they were able to remove whatever, like I heard that there were more roosters or more chickens that were back, like the person who had
and
them.
dogs and other things going on there. Yeah.
Yeah. And so, so now the mayor's office has a whole team working on it. So hopefully that will be resolved shortly.
Okay. You will keep us posted, right?
Yes, definitely. As soon as I get an update, I will definitely let you know.
Great, thank you.
Let me go back to measles for a moment.
Sure.
I think what you said earlier is that there have been 14 cases in New York City.
16 as
16?
of 10. Yep. There were 14 last year.
Oh, 14 last year and 16 this year. That's right. You said there were two more than last year.
That's right.
But and then certainly we had a number of years where it was much lower. So 16, even having 16 cases is a matter of concern, is it not?
It is, yes, which is why we are trying to make sure that we've notified, practitioners, pediatricians especially, to make sure kids who are school aged and going to New York City public schools are vaccinated. I believe Catholic schools and parochial schools follow the New York State Department of Education regulations for vaccinations. So, you are not able to go to school unless you're up to date with your vaccinations. So that's how we are trying our best to make sure people are vaccinated. But again, there are, adults, or there are travel cases. And there's also, cases where you did receive all of your vaccinations as a child, but your body's like metabolized the vaccination. And so you need a booster. So we encourage, adults to maybe check in with their primary care physician, get a blood test to see whether or not you need an MMR booster, and to get that so that you are fully up to date and protected from measles, mumps, and rubella.
Do you have the information on where these 16 cases have been located?
Exactly.
So they have been across the city, and only 2 were confirmed in Manhattan, and they were in Lower Manhattan.
All right, so far
And we're not allowed to share any more information other than that for privacy.
Okay. Well, I'm not asking for any names, but yeah, but
they were adults and they were known to each other. So I think that is all the information that we are able to share.
Well, I wasn't even asking for that, but I didn't care whether they knew each other or not. But but there have been no cases in Upper Manhattan.
That is correct.
Oh well, I guess that's a relief.
One more.
OC again.
Yeah, avian flu.
No recent updates on avian flu, but I will definitely check, with our team, and then if there are any updates, I will share them with you.
Okay, thank you.
Sure. Okay, anything else? Is that it? Very good. Okay, thank you, Pauline.
Thank you.
Oh, you know what I forgot to do? No, I can't believe you let me get away with this. So at the beginning of the meeting, I should have introduced my committee members. OC Kaminer, my vice chair, John Francis, Jacob Banis, and Heidi Guzman. And we're missing Richard Allman. So we have 5 of our 6 members, which constitutes at least 80% of this committee. Okay, Julio Batista from New York Presbyterian Hospital. Welcome.
Thank you for the welcoming. So I'll start off with how you start off the meeting with COVID. I'll give you the numbers for our uptown. So throughout our hospital system, we had 59 cases. In Washington Heights and Inwood, we had a total of 21 cases. That was 1 at the Allen Hospital, 15 at the Columbia campus, the Milstein, and then the Morgan Stanley Children's Hospital, we have 5. So that gives it a total of 21. Also, just want to sort of close the loop on the Allen Hospital psychiatric beds. Happy to report that patients are now, being admitted. That unit has reopened. As you remember, that unit opened with 26 beds, as was reported. And the reason it was sort of scaled down is because of new regulations from the state, which, to bring it up to code, apparently the rooms have to be somewhat certain size. So that is now operational, open at the Allen Hospital. Now,
I'm sorry, 1 second. Is it 26 or 24 beds?
I believe it's 20. It's from 30 to 26, as I was told.
Oh, really? Because up until now we've been told 24. 26 is 26 is very good, because it also means that hopefully we get the full 30 beds back when the other 4 are put in at Milstein.
Right. So the Milstein, as mentioned before, that unit is also being brought up to code. That unit being at the ninth floor at the Milstein Hospital building. That unit is now bringing up to code, is under renovations. When the renovations are completed, we will get 4 additional beds at the Milstein when it opens later in 2026. One of the things that Dr. Colleen Cook, our COO, has mentioned is that she was highly impressed by the work that and how it looks and how peaceful it is when she looked at the Allen Hospital psychiatric unit. And so she has mentioned that, before the Milstein Hospital psychiatric bed opens up, we would like to do a tour so that you can see the space before patients move in there. So I will keep that in mind so that when it comes time, for that unit to open, we could have a little tour and you can see it for yourself, how it looks. So again, that will probably be sometime in the third quarter of 2026.
Well, let me just say, I wish we had like a band or somebody to play some music to celebrate the fact that the psych beds are back at the Allen Hospital. Something that we've been waiting for about 5 years for, and which we've been pushing for, constantly, as you know. So I'm, I'm very happy. We thought that we were going to get the beds back earlier this year, but at least now they are actually back and are being utilized. Should I assume it sounds like maybe some of the patients who were at Milstein, if the Milstein unit is now closed, is it fair to assume that some of those patients were then moved up to
Right.
Allen?
Yeah, absolutely. Yeah, that's fair to assume. Yeah. So whatever patients were there were then transferred to the Allen. Yes.
All right, so I am hoping that there is still some capacity to accept new patients.
Mhm.
Because there is that continuing need to provide this service to people in our community and in the surrounding communities.
Yeah. No, I agree with you. Yeah, I just also wanted to last month, your last meeting, the nurses union attended the meeting, reported that contract negotiations were going to start with the hospital. They were looking for a nearby site to be able to hold these meetings. And I just wanted to acknowledge and really thank Community Board 12, Ebenezer, Paola, and of course Naomi, for helping out, supporting, and lending the some space for for them to talk. So those negotiations have started. The negotiations between the hospital and the nurses union. We're not the only hospital that that's going through the contract negotiations. Others as well, but for our purposes up here, they have met really. I believe they used the large conference room yesterday to be able to meet and discuss. So just wanted to really thank the board for that support.
Are they also using the second floor for the
No,
actual?
no,
No?
no. They use this.
Okay,
They use the Shabazz Center, and I guess
Oh.
for a brief period, the boardroom where the conference room where the health committee usually meets.
So both the hospital and the union
Yeah,
are actually negotiating in that room?
I I believe so. Yeah, yeah. I could get you the specific details because they're also using the Shabazz Center. So
Yeah, that's why, yeah. Yeah,
yeah.
what they told me at one point, and I don't know if it was just a one-time only situation, was that the negotiations were taking place at the Shabazz Center, but then the union would come over here to our space to have its own private meeting.
Mhm.
So, but if both sides can fit in our space, that's great.
Yeah.
I mean,
So yeah. So again, I just wanted to acknowledge and thank the board for that support.
All right, very good.
Yeah, those are my three points that I just wanted to present on.
Okay, very good. Any questions for Julio? Not one. Oh my God. Is well, is there any news about the new building on Broadway between 169th and 170th?
I don't have any new details on it, other than, I'm not sure if Columbia's on here, but,
No,
maybe
they're not
Sonya's
with us.
office, yeah, Son's office will be able to have that. As you know, that space has been turned over to Columbia for them
Right.
to develop at this point. Work continues on at the Beacon site, Beacon Building on 165th Street. They are doing the excavations, digging the sort of for the foundation. And hopefully that would continue on for the next few months before the actual foundation will be starting to be poured. So, but work at the 165th Street continues.
I don't know whether you ever reported to us about the new restaurateur selected for the Coogan site. Did you ever get
Yeah,
it?
I believe last month I reported that
Oh, yeah.
the space has been leased out. But hopefully, sometime in the second quarter, I believe, of 2026, that space will be open. It's part of the family of the Monaco, famed downtown restaurant. Um, I forgot the actual name, but it's Boogie Bakery and Bristow, I believe is what it is.
With,
They will have they will have they will start off with breakfast. You could be able to have breakfast. They'll have sort of a meeting space similar to what Coogan's had. So for sort of larger gatherings will be available as well. And we're hoping to, before also it opens, that suggestion was made that it'll be nice for them to do sort of a welcoming with community stakeholders to be able to come and see the space, probably maybe some samples before it opens to the general public.
well, speaking on behalf of one of the stakeholders, I believe he has an interest in knowing whether or not there's going to be a dinner service and whether or not the restaurant is going to stay open late. Because I heard that might not be the case.
Well, I thought by my understanding, they will serve breakfast, lunch, and dinner.
I hope so. Okay, but
Yeah.
all right, very good.
Yeah.
Okay, those are my questions, or at least I'm speaking on behalf of that stakeholder.
Yeah.
Okay, very good. All right, thank you, Julio.
Sure.
Okay, we're now going to hear from Diane Ashley from MJHS, also Isabella Geriatric Center.
Good evening, everybody. Can you hear me? I have to use my phone. Can you hear the?
Oh, we hear you perfectly.
You're
Okay,
perfect.
thank you.
No echo.
Thank
Yeah.
you.
And you don't sound.
My
you don't
computer
sound-
sound isn't working at all, which is probably why that's happening.
Okay.
Good news, short report. No COVID, no flu, no RSV, no norovirus.
Wow.
And about 70% of our residents are already vaccinated for flu. And I think that's about it.
Well, that is good news. Any questions for Diane? And is there any has there been any further discussion about opening up the social hall for meetings?
I do not believe there has been. We are hosting Waikoa, but we haven't
Okay.
gone beyond that yet.
Okay.
So I can certainly inquire.
All right, very good. All right, thank you very much.
Thank you.
We did receive a report from Columbia University Irving Medical Center, which I forwarded to the committee members earlier today. In terms of community updates and events, they report about a Latin Faces Wellness Health Fair, about a celebration of Latino Physician Day, that there was a My Block initiative, had a community day at Quisqueya Playground. Hispanic Heritage Month was held at Haven Plaza. There's a state pre-college enrichment program, which they are accepting applications, must be submitted by November the 1st. They also sent us a flyer, which hopefully the community board will also circulate. There is Columbia Radiology is hosting a Breast Cancer Awareness Month event on all Tuesdays in October at Haven Plaza from 10 a.m. to 2 p.m. Community members will learn about breast cancer prevention, early detection, self-exam tutorials, mammogram resources, new breast imaging techniques offered at Columbia, and more. They also hosted 1,000 elementary school kids at Haven Plaza for a program called Curious Minds Science Zone. More than 50 faculty, staff, and student volunteers from Columbia held a variety of hands-on science activities for the kids. They also are having on October 25th a free event at the Jerome L. Green Science Center, which is down around 125th Street. This event celebrates the wonders of electricity and energy, sparking curiosity about how electricity powers our world and more. It's October 25th from 1 to 4 p.m. You need to reserve tickets to participate. Oh, this is interesting. Let me see if I can pronounce this because our president was unable to. Acetaminophen, the active ingredient in Tylenol, has been used for over a century to treat pain and fevers, and is one of the most studied medications in history. Several professors at Columbia University Irving Medical Center addressed top questions about Tylenol and autism, including what the science says and what researchers are still learning. And there's a link in the report that was sent to us so that we can learn more about this. Acetaminophen. I said it twice now. And then finally, metabolic markers may predict breast cancer in high-risk women. And again, there's a link here to see an article about this and learn more. Breast cancer remains the most common cancer and the leading cause of cancer-related death among women worldwide, with the incidence rates continuing to rise. And I've certainly known women who have suffered from this. Researchers are increasingly turning to metabolomics, the large-scale study of small molecules and biological systems, as a promising avenue for identifying new risk factors and improving prediction methods for breast cancer. And again, to learn more about metabolic markers, please see the article linked to the report. So that, I guess we're going to we'll post that report, I guess, on the CB12 website so that members of the public can also utilize those links. Next on the agenda.
Is that our screen? Is that Pauline's screen?
Yes, that's Pauline.
Okay.
All right, so next, our annual discussion and vote on the expense and capital budget request and now we're looking at fiscal year 27, which begins July 1st of 2026 and continues until June 30th of 2027. So I distributed our one-page sheet of the 9 expense budget and 4 capital budget requests that we had last year. And you should know, by the way, that I received an email earlier today from Mary Anderson saying that her committee fully supports our continuing to advocate for increased mental health services, which, and I assume that this is an item our committee has carried for a number of years successfully, because the full board is also, for the most part, agreed to rank this as a high priority. So what we're gonna do, let's go down this list and see if we want to make any changes, and if we want to drop any of these items or add anything, or change any of the language. So, again, the first item we had last year was to expand mental health services and outreach in the community, especially for suicide prevention and for those whose mental health and social engagement have been adversely impacted by COVID-19. Any suggestions on this one?
I think stay number one. I was literally over by 167th Street like last week with my wife. And yeah, it definitely helped. So personally for me, number one, we just stay.
All right, very good. Number two is to increase substance abuse services in our community. And we just heard a presentation on this topic tonight, including opioid overdose prevention education. Wow, we were pretty, we had some good foresight on this one. And funding for syringe cleanups and collections. I assume we want to keep this one as well?
Yeah, but I don't know why I'm thinking that should be number one. But you know, let's go over all of them.
Okay, yeah, we don't have to rank them right now. Let's go through the list and then rank them. Okay, number three last year was to provide funding to ensure that all local public schools have multi-service health clinics with nurses and social workers. Number four last year was to provide funding for more noise enforcement cameras, which should be installed in both Washington Heights and Inwood, and staff for the program, as well as for more inspectors. Now, as I checked with DEP on this one, we do have, and I didn't, I forgot, I didn't follow up with the question. We do have in the community at this point one of these cameras. I don't know whether it's in Washington Heights or in Inwood, because I didn't follow up with that question. I don't know. Actually, I don't even know if he would have told me, but I assume he would have. But clearly, we do need at least, I think we should have at least one in each part of our district. We should at least have one, at least, I think, in Washington Heights and another one in Inwood. So I think that's a good item to continue as well. Number five, increase funding for education and outreach on recycling, reuse and composting, as well as proper disposal of household garbage in our community. Number six was to increase services to prevent and treat chronic diseases such as dementia, diabetes, cancer, heart disease, and hypertension, conditions that increase susceptibility to COVID-19, as well as long COVID in our community. Number seven was to increase trash basket collection on commercial streets in District 12M with a second shift so that baskets are emptied more than once daily, and increase the number of trash baskets on the streets throughout our community. We made a point of saying here that this could be funded through the council's New York City Cleanup Initiative, as well as the executive budget. Number eight last year was to increase HIV/AIDS prevention and treatment services and LGBTQ services in our community. And number nine was to increase pest control efforts to eliminate rats in our community. I have a note here that after we had the presentation from the DP Borough Commissioner last month, I wrote something here about funding for the Bureau of Water and Sewer Operations. Can you remember what might have prompted that?
Legionnaires' disease?
No. There was something about I don't know why I wrote this.
Maybe you meant to ask for it and you just didn't?
No, but what he said something during his presentation that led me to write this down, that more funding was needed for the water and sewer operations. But I don't remember what that
Well,
was.
the flooding that the catch basin, the catch basins are at capacity and they're not operating properly, so they need to like fix them or like
We're gonna clean them out more often.
yeah.
I
Yes.
think it may have been Steve, where I think they're upgrading their not the catch basins, but the amount of water that flows you know, I'm not sure you call them pipes, but what are those things called? Um,
Well, the sewer lines,
well, like the sewer lines, right? They were, so when they get around, certain things, they put in money to be able to make them larger and upgrade them. So that
yeah,
so the
yeah.
amount of water
Right,
more water will flow out. I think
yeah.
that's what you mentioned that,
Well,
you know,
that's actually one of our continuing capital budget items is to call for the replacement of old water mains and sewer lines. But I think John is correct. I think this rings a bell. I think there was something about how maybe more staff was needed to maintain the catch basins. So I don't know, did we could possibly add that as another item? All right, so is there any sense of whether we should change the order of any of these?
Uh, don't, five, well, not necessarily five, but 6 and 9 kind of go together because a lot of the pest issues come about due to, no, wait, not 5 and 6, I mean, 7 and 9, sorry, go together because a lot of the pest issues come about because of, how people are using their trash. And now there's new trash bins that are popping up.
Well, I don't know, I think that the rat issues, I think, go beyond that and, speak to how, people are handling their garbage in their own buildings uh, and on the streets. But,
How would those
Can I-
hideous,
and it's really.
receptacles that,
And the rat issue, you see, the rat issue is really dealt with by the health department, and the trash basket collection is handled by sanitation. So these are really issues that have to be kept separate because they're directed at different agencies.
Steve, sorry.
Yeah, Julio.
Yeah, I was gonna say, when you talk about the rat issue and sort of the cleanliness, I'm not sure, and folks who drive are gonna kill me, and when I say this, but you have this pilot program in Community Board 9,
yeah, terrible.
where they put these large receptacle. Now, buildings are able to go in there and just bring the stuff anytime.
Right.
And it does seem to have helped out with the rat issues. So I'm not sure if the city's thinking of expanding
Oh,
beyond
yes, yeah,
Route 9, but I
this
think
this containerization program is gonna be expanded citywide.
so. I mean, I mean, I know it certainly has helped in Board 9.
Yeah.
But of course, it does impair a lot of does takes a lot of space.
It does
Yes.
take space
Yeah.
and it take parking spots and it doesn't solve the wreck situation. Because not everyone are opening the lid to put the
Well,
trash in, there are rats around there too.
Well,
So,
I could say though, Steve, that in terms of like at least 153rd, I had seen rats before. I'm not sure because of the cemetery they came from, that area, but I have not seen since those containers were there. I have not seen any issues with rats.
Oh, that's amazing.
wait,
well, the
there is another pilot about like rats birth control. So
Oh, yeah.
we don't really know what's working.
Well, I don't know. The city has said that the number of rat complaints in this area where they installed the containers has declined significantly. By a fairly large percentage.
Mhm. Yeah.
So I think.
Do you live next to one of those?
What, the containers?
Yeah.
I would. I like them.
Really?
Yeah, I'm also not a driver, so I recognize
Yeah.
that losing parking spots is not
Yeah.
great, but
Yeah.
Visually speaking, do you want that outside your window?
I do. I wish we had them in our
We don't
community.
have the alleyways and.
Yeah.
Yeah. Yeah.
Just a part of the.
Well,
I know it's probably not the most sightly thing, but the alternative is the pile of trash bags. Like,
yeah, you're right. Yeah, and the pile of trash bags is not.
No,
very
there is
good.
like containers that they have to, there's,
Well, actually, so the reality is we'll have to see whether the new administration continues this program.
hopefully they won't. In my view.
All right, so I think what I'm hearing is that I don't hear anybody suggesting we make any real changes in the order of these items.
Would you wanna put it down lower then?
You know,
To
which one do you wanna,
well, I guess not, it doesn't apply to this, but the increased trash basket collection, no, wait, I guess,
yeah,
no.
yeah,
Excuse
no,
me.
no, her issue is different, yeah.
No, mine is different.
Yeah, we're not really touching upon that question.
The only thing that I'm not even sure that I agree with this, but obviously noise has been a very large issue.
Yes,
And so moving currently item number 4 about the cameras, maybe up one to kind of reflect that noise has been an ongoing concern in the community, and I think enforcement of excessive noise, I think, is important.
well, I would go along with that.
Yeah, I'm fine with that.
So you wanna switch 3 and 4?
Yeah.
Okay.
That way.
All right, very good. You know, let's make some kind of change,
Okay,
not do the same exact thing year after year.
what about switching to become number 1?
I don't wanna give up on mental health services and.
We're not
and-
giving up, we're
and
just
it-
switching.
I know,
I
but,
feel like one leads into the other.
yes, yeah. Substance abuse is connected, as we heard in the presentation earlier, is connected with mental health, but mental health, I think, speaks to broader issues.
Okay,
Then in terms of the DEP and sewer, is that gonna be at the bottom?
Yeah,
Where are we putting that?
yeah, making that number 10.
Okay.
and just an FYI, that's the expense, right? Yeah.
Yeah.
Oh, yeah.
Okay, so now are we ready? Are we ready for capital?
Would that be?
No, not. What?
Sorry, the sewer thing.
What's that?
Sewer thing,
Would that be
that's a capital
capital?
expense.
No.
Sorry.
The item about getting staff to clean the catch basins,
Oh,
okay,
okay. No,
that that's an expense item.
Right.
That would be number 10.
That would be
Yeah.
number 10, yeah.
I just wanna say that the city council approved $1 million for spay neuter. And I think, $500,000 for food distribution for low income pet owners.
It's amazing.
Yeah, well, it's
For-
really a drop in the bucket, they,
For
you know,
for the pets?
yeah. So, you know,
You know, I think, I mean, this is really off on a tangent, but, I read earlier today an obituary for Diane Keaton.
mhm,
And apparently, her family is saying that instead of flowers or whatever, people should make donations to animal shelters and to programs to help feed animals.
okay. Okay,
Wait a minute.
we can add that. I
No,
mean,
that's a.
Right,
that-
but
that's
the
a-
fact that, the fact that
yeah,
city council already
yeah,
have
right,
that,
Right,
I think we should ask for some services in our neighborhood. And I thought we had something a year or so ago.
we never had it on this list. We did a resolution.
Yes,
But we never put it on this list.
okay, alright,
I mean, what would the language be?
Yeah.
I think I would be willing to support something at the end of our list here, like add it on, throw it on there.
um. To
What,
designate, no, that's specific one, but you know, to designate, spay, neuter, wellness, vaccination.
We provide
I don't
funding
wanna say-
for,
What's that?
provide funding for
Yeah,
a,
for
yeah.
for low income pet owners in our district. That's so it's spay, neuter, wellness, vaccination. And I don't know if clinics are something that will discourage, because this clinics meaning like brick and mortar space. So I would say events, maybe,
Services.
find out what services, thank you, okay, fine,
These are pretty open-ended how they're provided.
yeah. It's insane, and sorry, I have
So-
to,
so provide funding for spay, neuter,
wellness,
vaccination.
vaccination, what do you say, services?
And you mentioned food?
It's a spay,
Spay?
neuter, wellness
Wellness.
and vaccination services.
Yes. Yeah, they do have
For-
food distribution, but it's a
for-
drop in the bucket. And we want to have it in our district, why not?
Sure.
If they already approved some money for it, we want it here.
And is that going to
For-
DOH, like the receiving agency?
Yeah, I think it had, yeah,
Well-
or does it,
Who's getting the money for the hour? How
Yes.
they get the money? Probably DOH.
well, we can find out, where the city council allocated its funding, how, to which agency.
Okay.
It should, that should be public, that should be in the, city council budget documents.
Right.
Now, did you want to say that these are services for pets owned by low-income residents?
So that's the purpose of it. This is how the city council designated it, you know? I mean, it's general, there's no, I mean. Not sure how they're gonna go about it, but
But is that the way to phrase it?
yes,
Okay.
Yeah.
All right, so where do you want it to go on this list?
oh. That's a good question, I don't know. I'm not sure what you guys think.
It's the 11th item.
Yeah, I mean, I know
Yeah,
all
no, I
important
figure.
items, but I might have a few to tack it on.
All right, so the number 11. Okay. Okay, now on the capital budget. We recently heard from a representative from EMS that they've overgrown the current location and that they would like to have a new, and when the current location was, it's really a prefab building. It was never, it's not a brick and mortar. It was, but it's like, it's really an enhanced trailer, yeah.
Trailer.
And so, you know, they never got a permanent facility. So, I'd like to add to our list,
Yeah,
acquire a site and construct a permanent EMS space station for our community.
absolutely.
Um,
How come the hospital cannot designate space for this? Oh, yeah,
oh, yeah, you
What,
need,
what space? I don't quite understand.
Yeah, that's true too. Do other hospitals do that? Do you know, Julia?
I don't know.
well,
Do provide space for ambulances?
yeah,
Essentially, yeah.
Yeah, but
space.
these EMS space stations are basically standalone sites. They're not our EMS space station before they moved up here. They were down at Harlem Hospital,
Mhm.
but
They were in a hospital.
they were in a hospital. That's true, but it wasn't really suitable.
Yeah, I mean, in what space is the question? That's
Yeah.
fair, but that's always the question in this city, isn't it?
Yeah. All right, so and I would like to
Are we in the capital improvements?
yeah, we're in the capital. So,
Okay.
so let's go through that list. This is, you know, many of these are just longstanding items.
Mhm.
Expedite the construction of the new garage for District 8M and relocate its trucks from District 12 as quickly as possible to comply with the city charter's co-terminality mandate. That to me is still very important.
Isn't it continuing support for like 500 years?
Now, the continuing support is a term that you would use for something that's already funded but
Right,
has yet to be constructed.
exactly.
Right, so,
Is this not the case?
no,
I don't
no,
think it was
it's
that
not the case. They still haven't designated a site for a new garage for District 8. You know, there's It's not in the budget anywhere. They gotta do that. At one point, they had a site, they were looking at, something around 26th Street, and then they decided to do something else with that property.
Right, because rich people live there.
Well, it became, I think,
Yeah, it just says supports but cannot accommodate resubmit.
yeah. Okay, so, and then, number 2 here was provide additional garbage collection trucks and street sweepers. I would, I would put that lower down. Number 3 is continue the replacement of old water mains and sewer lines.
Can you put that number 2 then?
Yeah, I would do that as,
I mean,
I would
put
either-
the question.
I would either do that or the EMS station as number 2.
Okay.
And then number 4 here is install green infrastructure such as bioswales to divert stormwater from the sewer system and address climate change issues in our community. All right, so do we want to keep the sanitation garage as number 1?
Yes.
Yeah.
And you?
I want to suggest that we make the EMS station the first one. Because it's something that we haven't asked for before and because there's a very serious need for that in the community. We heard from FDNY
Okay.
the number of calls that
Yeah.
that facility handles and
Okay,
I think that that should be really heavily supported. But the other thing I was gonna say is I don't think that we should give up on the funding for a garage for the.
well, we could
the
make,
garbage. Yeah.
make it number 2.
Yeah, and that'd be great. And then the other thing I was gonna say on that front, Steve, is I don't wanna get off track, but have we ever talked with like the public advocate's office about that or something? I mean, our argument has always been that it's a violation of the city charter and short of suing the city, I'm not sure how we resolve that.
Yeah. Well, I have not discussed it with the public advocate's office, no.
I don't know if that would be like the appropriate avenue, but it
Yeah.
seems like it would be a good escalation if we really wanna take up that issue.
Well,
Just thinking over here.
yeah.
Well, I think the moving the you know, the sanitation trucks to District 8, I mean, those that service District 8. And I think we are hosting some that service Bronx.
Yes.
Is that correct?
Yes,
There you go. So we
Oh,
have,
look at us.
right? We
Yeah,
are
we're-
hosting,
yeah,
So,
yeah,
not to move past that, so I used to work with Jemani,
Mhm.
the answer is yes,
Mhm.
but there's been some turnover.
Ah.
So the guy who you normally talk to is not there anymore.
Mm.
So until they find a new guy, he probably not gonna get much of a response.
Okay,
So,
well, we can come back to that.
well, there was somebody from that office who came to our community board meetings on a regular.
Mhm.
yeah, we usually send people out to like inform them what all the works that we're doing and then.
Yeah, so is that guy left?
No. So
Yeah,
we have,
that's true.
so there's Jemani and then there's deputy public advocates who
Right.
then handle all the administrative stuff.
Are you with that office now?
I used to be.
Oh, used to be. Oh, okay.
That's
So,
why he's speaking on it.
Yeah.
Or if you were, you wouldn't.
it was Solomon. Solomon used to be the one to like deal with these kind of things.
Well, that's what we need. We need a Solomon.
He actually lives right here.
Knock on doors.
Well, God, we actually have a Solomon in our district. Okay,
and do I wanna add to it that we are also hosting the buses, which not really related to us, but we are hosting buses.
yeah,
from
but
the-
I know,
the
but,
Bronx.
okay, but that's a
You know
completely different issue. Cause the city, the MTA is not subject to the city charter. The city charter, though, says that the service is to be provided, in your own district. It's
I understand it,
Yeah.
but I mean, we should put insert a line into this item.
Yeah.
That not only we are hosting District 8, we are hosting the Bronx.
Yes.
And we are hosting
Yes.
buses so we are hosting a lot that we shouldn't. Just clear, simple,
Wow.
right?
that's good, that's good, that's good.
Alright,
That's
so
good.
we're starting with 1, we're requesting to move the
Well, what
sorry,
is the EMS station?
Oh, 1 is the EMS, okay. Yes, no, but what I meant to say is that I mentioned 3 things that we don't want in our district anymore, right? So the one on this item, I mean, when we are presenting that, I think we should explain that it's not the only thing that we are hosting that is not
Yes.
servicing us.
Very good point.
Okay.
Yes.
So
Alright.
that has to be lined, the line, this has to be revised.
Yes, I'm gonna do that.
Oh.
Yeah, I don't want you to be mad at me. Okay, so, yeah, so that's gonna be number two. And, the number three, I suggest should be the, replacement of the old water mains and sewer lines. We just had another water main break up in, Inwood,
Yeah.
over the weekend. The second one in Inwood, in the space of maybe a month.
Mhm.
Yeah.
So, that's still a real issue, I believe.
Yeah.
Then number four could be, providing the additional garbage trucks and then bioswales could be number five.
That sounds good to me.
Okay, do we have a motion?
Second.
What's that?
I thought you were moving.
Did you make a motion?
Okay, I make a motion to approve the ranking with the modifications stated. And
Very good. The modifications for our FY 27 expense and capital budget request. Okay, oh,
That, and I'm gonna send you a guy I know. I'm gonna send the group a guy I know that might be able to help with that from Tomorrow's office. Sounds great.
okay, great. Send it to me, sir. Okay, so all those in favor of, seconded by Heidi, all those in favor of the motion, please raise your hands. That would be five. All those opposed, that would be none. All those abstaining, that would be none. The motion carries on a vote of 5 to 0. Okay, very good. That was a nice piece of business. Next on the agenda, old business, recycling statistics. The latest statistics available are from June, showing that our diversion rate was 17.1%, which is actually somewhat significantly higher than a year before, when it was at 15.6. I mean, if you can move up by 1.5 percentage points, that's not so easy. But it's interesting, the amount of paper, the tonnage of paper that was recycled between 2024 and 2025 went up from 399 tons to about 406. And however, the amount of metal, glass, and plastic dropped slightly from 419 to 418. The total amount of refuse dropped by about 25 tons. So
because of the compost.
well, in this case, maybe, and yeah, that should have been a factor. Yeah. Yes, look at this. Very good. Yeah, absolutely. Because the amount of organics that was recycled went from 39 tons all the way up to 126, 126.5. So that's very significant.
That's a lot.
Yeah.
And that's, what was the date range for that?
June 2024 versus June 2025.
Interesting, okay.
Okay, we also had a fairly successful event that we co-sponsored, an e-waste recycling collection event in Inwood last Saturday. It was conducted by the Lower East Side Ecology Center, which is funded to do these e-waste collections by the sanitation department. 145 people participated and provided 2,001 pounds. Isn't that a ton? Isn't that what's a ton?
Yes, it's a ton.
It's a ton.
2 pounds.
It's 1 pound more than a ton
Yes.
of unwanted electronics, which we collected. TVs, monitors, computers, laptops, all sorts of things. So it was, I mean, Inwood turns out, I guess, to be a place where people have a lot of stuff they want to get rid of. And
they get rid of it
Yeah.
in a right way.
in an environmentally beneficial way.
Right.
Christine Das Romero, who is the executive director of the Lower East Side Ecology Center, is saying that is already saying that we could come back to Board 12 next October of 2026. And I told her, yes, we want you to come back.
That has to be something, an event to take place every 6 months. But what is, once a year? I mean, come on.
Well, let me try talking to her about that.
Okay, and the other thing that I know Sally would have been really happy is to
Yes,
have,
yeah.
to have the event at the NYCHA on the other side of Inwood.
Right,
You
yeah.
know.
Yeah, she wanted to organize that, yeah.
Yeah.
As I did not get the latest report on DEP service requests. Do you have an update? Do you have something you wanted to say about ASPCA?
No, I don't have an update really. I will try to get him to come to the next meeting and see if we can have a presentation with data, how many pet owners showed up to the events that were held in, not only in Inwood, Washington Heights, they actually allow, at some point, they allow some, if they had like opening and the van was not in Inwood, Washington Heights and wasn't servicing Inwood, Washington Heights, but serviced another zip code. However, if they had opening, they did accommodate some. So it just came to the point where you didn't have to wait till 6 o'clock in the morning and start texting. You could text any time. And if they had any availability, they actually plug people in. The problem that I know he told me is with the NYCHA development in Inwood, that a lot of people will sign up, but then didn't show up. He said like it was really, really bad. So that's something, I don't know how to address it exactly, but something to be addressed. So I'll try to get him for next month.
Okay, very good. All right, any other old business? No, new business. So with respect to that water main break that took place over the weekend, up at I guess Broadway and Cumming Street. Our good friend Arlene Schulman, who used to be a member of this board, posted a bunch of stuff on Facebook, including a thing directed at me. How do we hold a hearing before the community board? She was very upset that there was no general notification in the community as to what was going on, what had occurred. She called up 311. They didn't know what was happening. They told her that she should file a complaint with HPD because there was no water in her building. She tried telling 311, it's not just my building, it's the whole community. It's not just an individual complaint. And nobody seemed to know for hours what was going on or how long the repair might take. Finally, I guess, and this was going on in the middle of the night, like at 2, 3, 4 in the
I
morning.
think it started around 1 AM,
Yeah,
but by midday, the following day, it was resolved.
but by midday that day, on Sunday.
Correct.
Yeah.
So,
Yeah.
so
Yeah.
it was like, about 12 hours. That's not bad.
You're right, yeah, well. But she seems to raise a legitimate point.
Right.
About the notification and people not being aware, or I don't, how you.
311 should have been aware of that.
What's that?
311, the operator. would have
Yeah,
been
you would
aware
think
of
so,
that.
yeah, you would think so. So, I did reach out to the Borough Commissioner at DEP,
Mhm.
the same guy who was at our meeting in September. He was away this week, but someone else in my email got referred to somebody else from the Government Affairs Division, who said she would call me. I exchanged emails with her, but didn't get a call back. So I'm wondering, maybe we may put this on as an item for next month. And maybe we can have somebody from DP talk in a little more detail about what they do to try to get the word out so people know what's going on.
I feel like that's something that, for example, Notify NYC, right?
Right.
They were the ones who advertised that in their presentation.
Yeah, he did, yes.
Yes.
Yeah.
That is
Only
something that I think Notify NYC sewer main
Yeah,
break
right.
on blah blah.
right. But Arlene says it wasn't on.
No, it wasn't.
Oh, you know that too? Yeah.
Yeah, no, it wasn't. I'm signed up for their messages.
Well, that's a good question, then why,
Yeah, like it.
why wasn't it on? Was it because,
type of thing
was
that
it
should be-
because it was in the middle of the night and nobody was working on, nobody,
No, people knew in the middle of the night that's happening. You know.
yeah, but no, maybe,
So,
maybe no, I don't know.
Why didn't the chain of command?
Right.
Start?
Right.
Yeah.
Who needed to say we need to
Were,
put
were,
it there?
Heidi, were you affected? Was this where you
No, I
lived?
wasn't, I
Okay.
just
Okay,
was thinking
yeah,
that's sort of like the reason why something like Notify NYC exists,
Right,
right?
okay.
So, for example, on that day, they sent a thing that was about the wind advisory, right?
yeah,
So, or, like
okay,
the parade, this parade means no alternate side parking, right?
yeah.
Like, I don't know,
Okay.
this seems like the type of thing that would
All
be
right, so
easy to notify through
right,
that
all right.
mechanism.
So it seems like a good issue to raise. Okay, so maybe this will be an item on our next agenda, maybe we'll have somebody from DEP address it. All right, any other new business? And actually, as long as we're talking about, the next meeting, well, actually, if you get someone from ASPCA, I'll hold this till, December or maybe even January. But we were contacted by, a representative from an organization called Beyond Plastics. And they would like to make a presentation to our committee about pending legislation in Albany, the Packaging Reduction and Recycling Infrastructure Act. And they're seeking our support for the passage of this legislation, which seems like a good issue for us to take on.
Yes.
So we may have this on our agenda, maybe in December at this rate. Depends on whether
Yeah.
you get somebody from the ASPCA.
Okay.
Do we want to revive the resolution that didn't pass about the noise?
Yes.
Plaza?
Yes.
Yeah.
Yes,
Okay, I
yeah,
guess for next month or something.
yeah, let's talk about that next month, yeah.
Yeah.
Yeah, let's come equipped to the meeting, to talk about how to revise that resolution.
Yeah.
Okay, so that's it for new business. Are there announcements? Yes, I have an announcement. If you're ready to celebrate Halloween 2 weeks early, the Parks Department has a Hollow Scream Fright Walk and Fall Festival at J. Hood Wright Park. We have a haunted house. The rec center has been transformed into a haunted house. So you can go through there on this Fright Walk, Friday from 4 to 7, and again, Saturday from 1 to 4. And then out in the park, there'll be various other activities as part of a fall festival from 12 to 3. And hopefully I'll get the community board to send out that flyer.
Okay.
And I asked them to send out the flyer for the e-waste collection. I don't know if it ever went out. I didn't
I
see it.
never see it.
Yeah,
I was shocked to hear that there was an event, it's sad that I missed it.
No.
I don't
No,
get it.
I don't know why.
I asked them to send it out twice.
There's a lot that
Yeah.
comes in.
All right, so that's it for announcements. And our next meeting is gonna be Thursday, November the 6th. Okay, I don't hear any objection. We're gonna adjourn this meeting. At whatever time it is,
9:51.
at
sorry.
at 8:49.
Or eight.
You, at 8:50 PM.
Wow,
You
record.
have,
8:50.
you have a lot of nerve, Olson. A lot of nerve. 8:50 PM on Thursday, October 16th. All right, thank you all, and once again, I think we had a pretty good meeting.
Good night,
Right.
everyone.
All right, take care.
Good night, Julio.
All right, thank you, Julio.
Bye-bye.
Okay. That was the work. Well, I'll be on email. Yeah.
That's your-
No, that's a good idea. Oh.
I think, right?
All right.